taking you back to our main story now. Health workers in England and Northern Ireland have begun a 4-hour strike this morning. It's likely some services will be disrupted as part of the walkout.
NHS staff are protesting against the government's decision not to give a recommended 1% pay rise to all NHS employees.
Well, 7 unions are taking part in the strike, including the Royal College of Midwives, who are walking out for the first time in their history.
Unions taking part have more than 400,000 members across England out of a total of 1.3 million NHS staff.
The strike will be followed by 4 days of working to rule, starting tomorrow.
Well, Dave Prentis is the General Secretary of the largest health union, Unison. He joins us now from a picket line in central London. Very good morning to you. Thanks very much for joining us. If you could just explain to viewers why so many of your members are said to be going out on strike.
Well, this is the last resort for us. But in the health service, we have a pay review body. It sets the rates of pay. The government put in their submission. The trade unions submit their evidence, and they decide the increase for health workers. This year, they decided with the government to implement a pay policy figure of 1%. Goes back to the Department of Health, goes back to the government ministers. They decide to renege on that agreement. And they say that only those at the very top of the grade can get 1%. It's not consolidated, can't be used for overtime, can't be used for pensions. And anybody working through the grades, maybe because of equal pay, working towards the top of the grade, they get no increase. They've reneged on a system of determining health service pay, which has meant that there has been no industrial action in the health service overpay for over 32 years. And we tried talking to the ministers, we tried talking to the department. Nobody will talk to us, nobody will listen, and as a last resort, we brought our members out on strike for 4 hours just to show the strength of feeling, just to show the people of this country what is happening to the people who look after us, who provide for us in our hour of need, who make sure that our health service runs, and the way in which they are now being treated.
The Health Secretary, Jeremy Hunt, saying if the recommended pay rise was implemented across the NHS, because there are many thousands that do get it, he says if it was implemented across the NHS, thousands of staff would have to be laid off.
Well, this is said, isn't it? And yet the pay review body was more than happy to come out with the 1%, which George Osborne, as Treasurer, has said that all public service workers should receive. When you look and say, well, you're going to lose nurses if we pay it, that's not the real truth, is it? Because we know that the NHS could be provided with more money. We know that all the political parties are saying that they're going to put more money in. But let's look at where the money could come from. It could come from dealing with tax evasion, tax avoidance by the rich, where now our economy is now growing at 3%. Where is the money going? It's going to the rich in our society. It's not going to our members in the health service who provide these essential services.
And we'll put some of those points to the Health Secretary, Jeremy Hunt. We are due to speak to him in half an hour or so. Let's talk about patients, because patients at the heart of the NHS, and many of them will be disrupted today. What is your message to them?
I didn't quite hear that question.
What is your message to patients who will be disrupted today?
We've put arrangements in place. Life and limb is covered. We've reached written agreements with employers to make sure that patients do not suffer. That patients will be inconvenienced. People will be inconvenienced, but we're making sure that we provide the essential services. We're keeping people in work. Control room centres are still in work. Triage is still in work. And we're doing everything that we can do not to hurt patients. Our dispute is with the Department of Health officials and with the Secretary of State, not with patients.
And you accept, though, that people will be concerned and worried about their health today in these 4 hours?
Of course people will be worried. Nobody can say that they won't be. But we put in place written agreements to ensure that life and limb is covered, to ensure that the health service can still provide that essential service that it's always provided. But what more can we do? We've tried everything. We want to talk to the department. We want to talk to the Secretary of State. They will not talk to us. They believe that they can just impose this and health service workers will just accept it. And I think they're a little bit shocked. They say the Royal College of Midwives 133 years of existence, for the first time they're taking industrial action. Something must be wrong and something must be done to alleviate the fears of all of our members.
Prentis from Unison, thank you. We will be speaking as well to the Royal College of Midwives later. Thank you. And also in about 25 minutes' time, we will also speak to the Health Secretary, Jeremy Hunt.
17 minutes past 7. Right now, time to catch up with the weather. And it's autumnal, definitely today morning.
Good morning. It certainly is, and all this week as well, Billy. The forecast is fairly changeable as we get into a new working week with rain.